Happy Friday, everyone, and welcome back to another episode of NHLN Opinion Plus, a weekly series airing every Friday. This is a place for our opinions where we talk about current events and questions the Latino community is curious about. Today, we will be joined by Patricia Tilley, Director of the New Hampshire Department of Health and Human Services and the Division of Public Health Services. Tilley is responsible for promoting and fostering systematic approaches to health and the well-being. Welcome, Patricia. Thank you so much for joining us this week.
Thank you for having me. It's a pleasure to be here.
Absolutely, absolutely. So yeah, let's get started by could you first off for me asking, could you please tell our audience your experiences with providing healthcare for Latinx and underrepresented communities in the state of New Hampshire?
Sure. So as you know, most people think when they think of New Hampshire, they have a certain vision in mind. And it might be a predominantly white state, a predominantly rural state, but we know that there are pockets of diverse communities throughout our state. And in particular, in the Latinx community, we have really focused on trying to ensure that we have access to care and ensuring that we have equitable health outcomes when we access that care. And so we've done a lot of work with our community health centers and working with community health workers in the community. But what I think is on most people's mind right now has been COVID. And we've certainly seen in New Hampshire, just like we've seen throughout the rest of the United States, that there's really been a disproportionate impact of COVID on the lives of Latinx community members. Again, not only throughout the United States, but here in New Hampshire as well.
Yeah, absolutely. That's, really good to point out. And so that kind of like leads me into my next question is, what is one thing that you've spotted within the creation of the New Hampshire Women's Infant and Children's Program, that this is a program that provides temporary benefits for women, infants, and children. So can you tell us a little bit about like what has led to the creation of this program and what impact have you seen within this program?
Oh, that's great. So our Women, Infant, and Children's program is called WIC, and that's really how most families know it.
Right.
And it is a supplemental nutrition program for pregnant women and their families up until their kiddo is about 5 years old. And one of the things that really makes this program great is the nutrition education that we provide and breastfeeding support. So we know that breastfeeding is one of the best ways to ensure that infants have appropriate nutrition. It has all sorts of other protective benefits of reducing ear infections. It really enhances the bond between moms and kids. And on top of that, it also helps connect those families to some of the other resources within the community. So not only does it enable families to get, again, really good, nutritious food, lots of fruits and veggies, some grains, formula if it's needed, or infant food if it's needed, but it also connects them back to some of those community resources around good nutrition education.
Yeah, absolutely. Those are all really, really good resources. And so kind of like, going off of that and just like remarking on like kind of like, the past year with the pandemic, can you tell us a bit about like what type of impact the pandemic has had within New Hampshire, and what type of protocols WIC has taken in order to best serve its citizens?
Sure. So, COVID was a game changer for everybody. There is no doubt about that. And in all of our services where we used to be face-to-face, all of a sudden now, just like we are today, we're behind screens. And so our WIC programs throughout the state really pivoted, and they were able to provide that service through telehealth and through other means, ensuring that our families got access to benefits, got their benefit card through the mail, and ensured they also got the rest of that education that they needed. So, like every single one of us, we thought we knew how to do our work a year and a half ago, and then we completely relearned how to do it. Food insecurity was certainly top of mind for all of us as the pandemic came, especially as lots of workers were in between jobs, or their job security was certainly not what it was before. And so WIC is one of those great places that really provides a safety net to young families at the time they need it most. And so those our WIC programs were able to meet the needs of our families. Moms were able to get their WIC benefits. We even worked with the grocery stores to figure out eventually how to do that so that they could get their do mobile delivery by car, like the rest of us did, where we drove up and we got our groceries, and all of those took some pretty big transformational change on the back end. It seems pretty simple of the things that we needed to do, but it took some work in order to fix that, in order to move forward.
Yeah, no, that's all really, really informative. Yeah, and so kind of like, going off of that was just like, with kind of like providing resources for, and like, equal healthcare for, for these underrepresented communities. What would you say has been like the biggest challenge relating specifically within New Hampshire and the Latinx community? And what steps have you taken in order to resolve those challenges?
Oh my goodness, there's a million places where we really need to buckle down and do some hard work in ensuring that we have equitable access to healthcare for everybody, and especially for the Latinx community, where we know language can be a barrier, culture can be a barrier, and we want to make sure that we get rid of those barriers to the greatest degree possible. So certainly, again, if you think about COVID, one of the things we've really focused on recently is vaccine. We encourage everyone to think about if vaccine is right for them and make sure that they're able to get it. We've been able to give over 1,400,000 vaccine doses across the state. And many of the times that was in these, larger vaccine centers where you had to either drive or, find your way to one of these fixed sites all around the state. And the National Guard helped us out and really did an amazing job. But what we learned is we also needed to be able to go right into the community on a much smaller scale and go and work with churches and work with community groups and work with the people who really knew their community, knew the language, knew the culture, and really focus those efforts in a really hyper local way and be able to make sure that we could have clinics that were culturally responsive with vaccinators who spoke the same language as the people getting their vaccine. And so while we've done this large scale vaccination work, we've also really narrowed in to try and meet the needs for people who may not have transportation or are working 12 hours a day, or just maybe aren't really trusting of some of those larger opportunities for people to get vaccine. So we need to go where there's trusted voices and work with our community and make sure that we can get not only vaccine, but in general, get healthcare where we need it the most.
Yeah, absolutely. Just like being able to communicate with those different people and to just like and to show them that like they do have the same access, they do have the same accessibility as anybody else, English and non-English speakers. And so, kind of, continuing on to like, on a further note, I've done research where the New Hampshire State Health Improvement Plan, their mission is to improve the overall health of New Hampshire and their citizens. What contributed to the start of this investigation, and what do you hope to kind of like, gain through like the motion program?
Sure. So I'm so glad you're asking me about something called our State Health Improvement Plan, which we call the SHIP. And even part of that is something that we call the SHA, which is the State Health Assessment. And so the way this works is that, in public health, we love our data and we love to be data driven. We want to know who the people are in our state, what services they need, what assets they bring. So not only the challenges and maybe the negative health outcomes, but also what resiliency they have. And so as public health departments do across the state, we go through a planning process so that we can prioritize where we're going to put our resources moving forward. So that's led us to our state health assessment and our state health improvement plan. We've actually put it into law, and the folks that come around that table is a large advisory group that represents every corner of the state of New Hampshire. And so where we are right now is we're doing that assessment. We're pulling all that data. We're looking for health disparities. We're looking to see what those resiliency and the assets are of each of our communities. And once we get all that data together, which should be probably later this summer, and we publish it, we then go through a process of figuring out, what do we do now? How do we prioritize the needs, and what are our strategies and our objectives to close some of those gaps?
Yeah, absolutely. No, that's all sounds like a really great thought process to figure out, okay, what is most urgent and how can we best support those that are in the most urgency. So yeah, my next question is explain the challenges of making healthcare and Medicaid affordable for underrepresented populations in New Hampshire.
Boy, that's a huge question. How do we make things affordable? And one of the ways we do that is with our Medicaid program and our Medicaid managed care program and expanded Medicaid so that we can have adults have access to health care, and so that they can go into, they can provide, or our healthcare providers can provide the care that we know they need to do, so that folks can access preventative health care. We know in particular in the Latinx community that there are some chronic diseases that are more prevalent than they are in the greater and especially the white community. One of those things is diabetes. So we want to make sure that people are getting that treated early and having access to some of those ideas around how do you manage that chronic disease, and how do you get the education around really simple things like, ensuring that you're walking and you're getting the right exercise and you're managing your diabetes well and you're getting the appropriate nutrition. This is where all those other programs that are even outside of the doctor's office is really important. Those nutrition programs, ensuring that folks have access to places like even the YMCA. We're working with a lot of YMCAs right now in making sure that people have access to ways in which that they can, not be rock star super fit, but really just get a little bit healthier, improve their walking. Those are ways that we think ultimately are going to cut the costs for long-term for health costs that we see in the traditional healthcare system. So it takes lots of pieces together. We need to make sure that folks have access to health insurance. We need to make sure that folks have access to some of those preventative services and that they have the right education, and we get rid of any of the other obstacles that might be in order to keep moving and keep up with those healthy foods.
Yeah, no, absolutely. That definitely all makes sense, and it's great that you're doing the hard stuff. Now, my next question is, what do you think are the most effective tools to best serve the citizens of New Hampshire? Since you've given a lot of resources, what do you think are the most effective resources?
Sure. That's, again, that's another great question around all of the resources that could possibly be available. And so I think about this across the lifespan. So, you start with young families when we've got infants and young children. And we know that that's a really critical time for development. And we know that's when our brains are being built. And so we need to ensure that we have the appropriate nutrition, kind of like that WIC program, making sure that we've got nutrition and nutrition education. And on top of that, we want to make sure that families have the resources and the education they need to really support child development, to make sure that we have the kind of environments where kids grow and thrive. And we know we can do that. We have family resource centers, we have parenting education. There's all sorts of community efforts that both public health and the Department of Health and Human Services ensures are available within the community. As kids get older, families have older children, there are different resources that they need. We want to ensure that adolescents have the appropriate preventative health care that they need. And we also want to think about things like injury prevention. So, we do a lot of work with our Department of Safety on driver's education. We know that adolescents and young adults, that's a real risk for them, is from injury from car crashes. And we've made incredible progress of reducing those injuries. Another area that we really focus on in that adolescent world is prevention around tobacco use and vaping. We've seen an exponential growth in the number of young adults and adolescents that are using vape products. And a lot of people think that they're just safer than cigarettes or regular combustible tobacco, but yet we really don't know the full health impact. And even before the pandemic, we certainly had heard a lot of news around the lung impact on those vape products. We also know that if you start vaping when you're a teenager, you're likely hooked to that tobacco and that nicotine for a really long time. And we do know the impact of nicotine and combustible cigarettes over the life course. We know that by the time you're 50, 60 years old, your lungs are going to be in bad shape and you're going to be likely to be able to be getting COPD, or you're going to increase your risk for cancer. So as you know, the families get older and individuals get older, we really, again, want to encourage folks to have all those healthy lifestyle behaviors, to make sure they're getting up and moving around and taking a walk. They have that access to nutritious food, that they've got access to safe and healthy housing. And all of those things, it's amazing. A lot of people don't think of those as public health items, but it is much a core focus of public health as it is focusing on infectious diseases and pandemics.
Yeah, absolutely. No, thank you so much for that. And yeah, I think that concludes our time with us today, Patricia. First, I want to say, thank you so much for talking with us. And yeah, are there any last minute thoughts you would like to say to our audience?
Sure. Well, first of all, thank you for having me. And, I just really appreciate the resiliency of the entire Latinx community in New Hampshire. We know that lots of folks have been out there on the front lines and working in healthcare and working in other service providers. And we just want to make sure that we acknowledge that it's been a tough year for everybody. And we can't wait for the summer. Everybody wear your sunscreen, watch out for those ticks. And we wish everyone good health.
Awesome. Thank you so much, Patricia. Yeah. So, thank you so much for speaking with us at NHLN, and yeah, hoping for the very best and continue the good work.
All right. Thank you so much.
That concludes our episode today on NHLN. Please tune in for another episode within 2 weeks. Please follow us on Twitter, NH Latino News, and our Instagram, NH_Latino News. I'm Bron Zapata with NHLN Opinion Plus, and have a great day. We'll see you soon.